disaster management plan and the policy. It's actually in accordance with the national one, which is the National Disaster Management Unit disaster plan and the policy, and that is how KNH also has. When you look at the Disaster Management Act in 2003, it is also guiding us on what is expected in terms of preparedness and the response and all the way until recovery. When we come to Disaster Management Regulation of 2014, it is still re-emphasizing on what all the hospitals are supposed to have, including the clinics and everything that you are able to do according to the regulations that have already been given in the document of 2014. Disaster Management Strategic Policy, KNH is one of them which has come up with a very good policy and a strategic plan of 2018 to 2023 on how we are supposed to do some of our things and the procedures. When we come to our disaster plan guide, I want to re-emphasize here that Kenyatta National Hospital has got a disaster plan and a policy, which is actually reviewed. Like now we have one which was already reviewed in 2020, and it is due for review in the next year. That is that year, because it's reviewed after every 3 years. When we come to further at the implementation level, we have a disaster management standard operating procedure, which is a corporate one. And this one comes to tell us what the procedure is done and how is it supposed to be done. Now, about all that regulation and the document, what is the aim of this disaster plan? Number one, disaster plan, it is there to provide for us a flexible good practice suggestions and advise our implementers on what is expected results after doing what is expected. This is the result of what is required. Then it is also there to guide on supporting implementation of the registration of 2014. And if we go further, and our document is actually very accessible, both in soft and both hard copy in our research centers. And this document, it is actually a guide for Kenyatta National Hospital and any other person who needs to know how disaster management is supposed to be carried on. When we further come on the ground, I talked about KNH corporate SOP for disaster management, which is number 6 in our disaster standard operating procedures, which is also very accessible to our implementers, that is people on the ground. We talked about the CBRN. CBRN is also a disaster on its own, and it has also a policy that is guiding on what is expected and what is supposed to be what. Like, for example, we have got some of the chemicals that are used in our industry. And we have got also chemicals that are being used in the hospital in terms of disinfection. And we have a policy which is guiding us on what is supposed to be where is it, how is it supposed to be transported, how is it supposed to be utilized or stored. And this document was actually brought into use in 2014 according to our government policies. The guiding principles of disaster preparedness and response include, number 1, it has to be a comprehensive approach. A comprehensive approach means that in all the stages of the disaster cycle, we are very sure that we have got 4 cycles in a disaster. The approach should be very comprehensive in that you cannot work without a plan in terms of prevention, in terms of preparedness, in terms of response, in terms of recovery. So we have to balance the risk. We have to balance between the risk reduction to enhance resilience. Resilience is coming back to normalcy. And then we have to ensure that the effective response and the recovery capability is put into place. And you cannot do this if you don't understand what are the sources of the disaster. And that is how we started by saying where the disasters come from. That is, it could be natural or human activity. Again, it is also guiding, the principles are also guiding us on internal issues, that is for the Kenyatta National Hospital in Kenya, on disaster management capability. And this one, it is guiding us on what resources do we need to have in terms of human resource, in terms of the supplies, in terms of the the agencies we require in terms of how are we supposed to be prepared. Because if we look at it, Kenyatta is a complex facility or institution or organization where we have got many departments, where we have got specialized care in whichever capacity. I can assure anybody who is listening and to us that KNH for sure is for the specialized, and that is why it has gained this a name, referral hospital, meaning that the things that cannot be added in other lower facilities, KNH is up to the task because of its speciality in terms of the way it is equipped, in terms of the way it has trained the personnel from doctors, nurses, and the other people who take any function in the hospital. Then we cannot also do without the guiding principles on who are supposed to be included in the event that we have a disaster. And that is why we are saying that we have a multi-agency or MOU for collaborators and stakeholders who are both locally and international. And we are doing this one as a collaborative and interoperability kind of a thing, where we have put the other government arms, that is the National Disaster Management Unit, all the way from the National Kenya Police. We have got the NDOC, that is National Disaster Operating Centers. We have the Kenya Police. We have the NMS. The NMS is the Metropolitan Services, the National Metropolitan Services. We have firefighters. We have other humanitarian dealing bodies like the Red Cross and St. John, where we offer various things like humanitarian, that is in case of food, in case of ambulances, in case of the specialized first responders. They are there to help us through the MOU Kenyatta National Hospital as engaged in. Then, as Kenyatta National Hospital, we have gone further to do what is called implementation of these documents. Let it be from the state, let it be from Kenyatta, let it be from the parliament. And the purpose of this is to test the preparedness. Number one on how we are doing this is regular evaluation. And we are evaluating ourselves through doing the mocks, which could be maybe a mass casualty incident, or we could be having the mocks to do with the CBRN, we could do a mock to do with the fires and all this. And all this, it is to make sure that we are actually up to the task through doing disaster risk reduction sensitizations. Further to that, KNH's breast, as I've said, it has got specialized issues. We have come to utilize our clubs with various specialities or talents, and they have innovated some of the actions that are going to mitigate disasters. And I can assure the government, the participants who are listening to us, it is good you liaise with us in most of our social forums. We have got disaster risk reduction, drama acted actions that are going to enable us to do the disaster risk reduction in terms of the way we are talking, in terms of the way we are socializing, in terms of the way we are discussing matters. It should not be something to raise harm or to raise emotions that can cause conflicts and fights, so that we stay well. Then if we listen to our telephone messages, there are messages that are telling us on what to expect when you come to Kenyatta National Hospital in terms of reassuring us that we are in the safe hands. And all this is to ensure that all of us, we are okay and we are comfortable visiting Kenyatta National Hospital for whatever service you are coming related to human life. When we come to posters, we have got a corporate department. As I said, we have many departments, which is working very closely to do posters that are also geared towards reducing the disasters that could be coming due to human hurt. Then, in terms of innovations, we have come up with joint responsibilities, where we have got various stakeholders with the different job cuts to ensure that disaster reduction is put at the apex and we don't expect the disasters that are coming from human activities because of what is being done. We have got educators and the policymakers who are there to improve the initiative, to ensure that the messages that are coming, or what we are seeing, what is being passed, is something to help every one of us not to come up with any disaster which could be prevented. Then in terms of also improvement on these policies, we do debrief on to analyze what has gone right, or what do we need to be prepared, so that in whichever way that we will not repeat the same mistake. If we do the debrief and it is showing that the mortalities came because of this, we are able to improve so that the next time we have zero mortality if possible, because that is what we are geared for. And this one, we are also doing the monitoring the reviews. That this is before and after any emergency, or even after every mock or drill, so that we are able to learn the risk and the lessons from what the actions that have taken place. Now, what is the law of Kenyatta National Hospital and the responsibilities in terms of preparedness, in terms of response to disasters or emergencies? We have an effective coordination when it comes to disasters, and this one has been enabled by our able KNH board, which has delegated through our CEO to our disaster chair, so that a good coordination is actually observed in the event of any emergency that could have come to our facility. On top of that, we have promote collaboration on capacity building. What I mean by this is that we have done our SWOT analysis as Kenyatta National Hospital, we have learned our weaknesses and our strengths, and we are taking the opportunities of what is there so that we are able to build capacities. When we are talking about the capacities, we are looking at who do we collaborate with so that we are able to build this capacity to deal with any emergency or any disaster that has come to our facility. And that's why we have come up with so many modalities to ensure that this one come to be attained. And I will come and discuss that one in the next bullet. Then hospital incident command system. This one we are putting it into practice, where we are doing everyone to have a job card. Or when it is a disaster, it's a coordinated kind of a seamless activity to ensure that everyone knows what is my part, what is my function, what is my law, what is my take, what are you bringing on the table when you are called upon to respond to a disaster. And we have got the X system, and that one is also guided by the document we have for Kenyatta National Hospital, that is the disaster plan and the policy. Now, when it comes to functional on disasters, the Kenyatta National Hospital has seen that there are varying issues that needs to be observed and taken care of, and that is why we have got many subcommittees which are geared towards the success of anything that would come to KNH in form of a mass incident or maybe a disaster, either internal or an external disaster. And that is why we have got the training subcommittee, which enables the Kenyatta team and others or other stakeholders who we have put into our interplay to make sure that they have the skills that is required, so that we can actually achieve what we are looking for in a seamless way. Then we have also a subcommittee which is dealing with hazard vulnerability assessment, and this one is done right from the mitigation space all the way to the recovery, so that we are able to do what it takes and be prepared to ensure that we are saving lives as per our mandate. And all that, we also have a budget, because anything that is called for, it is cost for finance implications, and that is why we have the budget which has to take care of every activity that is entitled to be taken care of during the disaster. And that one we have finance and the assisted by this subcommittee called the budget subcommittee to budget for anything that is required to be utilized and according to the supply chain management and the act that it has to appear in our procurement plan. Then we have got the subcommittee dealing with the MOU. MOU is the Memorandum of Understanding, and this one is a well-thought stakeholders plus other collaborators that have got a key role or component when it comes to disaster preparedness and response. And we have got hospitals, we have got non-hospitals, we have got the national securities and interiors, which can help us in the event of a disaster. Then we have got the Pulse Preparedness Subcommittee, which is there to take care of anything that may be required in the event that a disaster has happened and we require extra supplies and anything in terms of capability that it is called upon. When it comes to the reporting requirements, this one is very key so that we are able to have the data and have the statistics that we can form a premise so that we are able to prepare for future references and adequately be at the par. The coordinated and the scheduled quarterly disaster meetings are there to update us and make sure that we know where we are at any particular time, that we deal with the performance contract. We need to know in the first quarter, have we achieved, have we not achieved, what needs to be done and at what time and where and by who. Implementation on all disaster risk reduction measures, it is usually done through the well-analyzed and the data that are in record through the subcommittee, which is hazard vulnerability statistical data. Then, when it comes to mitigation actions, what do you need to be done during the mitigation? Number one, we need to understand there's advanced measures are to be done to reduce or eliminate disaster impacts. And some of the actions include, we have to identify what are these risks and which are the vulnerability issues that may come and become a problem so that we are able to mitigate it from already becoming a disaster. Then there is research that has to be done so that we are kept at par and ensure that everyone is understand what is expected at whatever department, whatever area of your service, that we needed to make sure that everything is okay, that there is no hazard that might come in. For example, in a working station, we needed to ensure that the working or the environmental safety is very key, and the different areas have been tasked, like the public health department, to ensure that environmental safety is very okay, and that one has done through the knowing what can cause the problem to the workers, to their customers, and anyone who is visiting the hospital. Then various channels are utilized to ensure that peaceful information or peaceful messages have been put in place. And this one I'm still overemphasize even to the participants who are listening and to us, that look at it as a disaster. In whatever we are talking during our social gatherings, what are we talking about? Is what I'm talking, is it a peaceful information that will trigger me to go to depart peacefully, or that it is going to trigger me to be the source of the disaster? Please let's think and rethink about it. As Kenyatta National Hospital, we are doing all the ways, we are doing whatever it takes so that everyone is safe and we don't have conflicts, we don't have violence, we don't have anything that can destabilize the human in totality. Then we are doing capacity building, like now what we are doing, we are capacity building everyone so that you are able to know that you need to be safe and you need to prepare for a disaster, right from the beginning to the last phase. Then resource mobilization. Let's know that when a disaster happens, there is nobody who is very equipped to say that I have all the resources that I will need. So you need to prepare and also look for other people and inform other people what is required for them to have so that they can be prepared in case of any eventuality. Empowering Kenyatta National Hospital departments and anyone, that is why we are calling them bloods, so that they are able to know how do we prepare, how do we respond to the disaster in the event that a disaster is happening. When we come to preparedness, this is the very key, and this is where we are because we are prepared. Anyone, if you expect a better recovery or a better response, preparedness is very key. So we have to be proactive in planning and budgeting for the resources in terms of equipment, in terms of human resource, in terms of anything that is required. So for this matter, and I'm talking in terms of hospitals, for this matter, Kenyatta National Hospital, all our departments should prepare or they prepare for the equipment in the event that we are called upon to respond for a patient, and this patient needs whatever equipment is supposed to be there. It is supposed to be ready and in working condition. And that is why we have got the biomedical department to ensure that the equipment we are having, they are up to the task, they are working and in good condition. Then we also have the risk management. What is this risk management? We have to recognize, we have a recognizing methodology on what is required for us. We have the department dealing with the register, the risk register. And when we call about register, is not a local. It is what is required in terms of hospital utility, equipment, and everything. Any item is in the inventory, and it is supposed to be audited and ensure that it is okay for any use. Then use of the scientific data analysis. I can attest that Kenyatta National Hospital, when it comes to data record, data preparedness, we can get their data and be able to prepare on what is expected in terms of what I've mentioned, equipment, human resource, and other supplies based on what happened in 1998 bomb blast, other mass incidences, and other disasters that have been recorded in our records in the country. Then when we look at the use of the geospatial information, we don't just say that we are self-reliant. We also interrogate other systems that can be of key to us during our MOU so that we are able to prepare in accordance to disaster preparedness. We also are involved with international disaster prevention strategies and the insights among disaster management team members. And that is why Kenyatta National Hospital has trained most of the people, most of the staff who are related to disaster mitigation, preparedness, and the response locally and internationally, so that we have various and advanced technology skills and capacity to deal with the disasters that are called to be dealt with as at level 6 level. We have also done benchmarking with other disaster-prone countries globally for optimal disaster victim management until the resilience level. What we mean by this, most of the time, we have been sent by the hospital to go to the areas where the disasters are almost the order of the day. And why they are sending us there, they want that scale or that optimal capability or empowerment is utilized in our country, because at most of the time, Kenyatta National Hospital takes care of the patients who are even from other countries. Apart from that, and we need to know what it takes for us to be at that level. When we come to response and the recovery, there are activities that are there to maintain the life. Remember, when a disaster happens, you are normal, but we want still to come back to that normalcy. So we have to improve the health. And when we are looking at that, we are looking at the health, body physical, we are at all the dimensions, holistically in terms of the psychological impact, in terms of emotional impact, in terms of our social impact and the financial. So we say in disaster response and recovery, we need to improve and ensure that our psychological support to the affected and infected are taken care of. In the response part still, we don't do as Kenyatta National Hospital, we do with the other sectors. That is why we said it is a kind of a collaborated kind of activity or a multi-agency kind of activity that needs everyone to be put on board so that we are able to achieve the objective of saving lives. And the tools and the mechanism for preparedness are for timely response are usually put into the key so that we are able to respond to the disasters appropriately. In the recovery part, we needed to offer serious strategies. And some of this one Kenyatta has been able to do is a rehabilitative part of it, because sometimes the patients will come and they have a comorbidity that has come due to the disaster in whichever way. Maybe it's a collapsed building, maybe it is a traffic accident that you have lost the hands. So we have to rehabilitate through using maybe prosthesis, which Kenyatta has got such a department, which they are able to do with the rehabilitative section. And for all this, we want to ensure that this patient will go back and continue the life as it was, even with whatever, but it has been assisted at least to go back to the normalcy. Then we promote disaster awareness culture and the capacity. For example, at this particular time, we want to ensure that everyone looks at the issues, even into your own home, wherever you are, you need to look at everything. A disaster has happened. How do we respond to it? So it is us at whichever way, in small and in big way, to ensure that we are prepared. We have done a mitigation survey. We have done hazard vulnerability, wherever we are, maybe at home, maybe in our workplace, and develop a culture which is geared towards being prepared and responding to it. But if possible, avoid to zero tolerance. Now, when it comes to hospital risk, most of the time people have asked, what about the hospital? We want to demystify the hospital risk. And we can only do this through adopting the national policies and the programs for safe hospital disaster responsiveness. This one is very key. Whatever policy that has been implemented to be the safety, the Workers Act on safety, we need to take care of it. If it is fire safety, we need to take care of it. The equipment we have in the hospital, let it be the fire extinguishers. It is our responsibility for all of us to know it is a risk if it is there and it has expired. So if a fire happens, it is not able to work well. So it is our responsibility to adopt the policies within the country, within the hospital setup, and adhere to them so that we are safe. We are there also to protect our equipment. We are there to make sure the medicine we are having, they are up to the task. You are not keeping drugs which are expired. You are not keeping the drugs which are outdated, but we are because this because it's a scientific research kind of a thing. The supplies we have, they are supposed to be ready and enough or adequate to deal with any emergencies that may come, because it can come anytime. On the other side, we needed to know that strengthening the hospital incident command system is key, and this one it is actually done at departmental levels. Every department has got a disaster champion, which those champions, they know how do they deal with a disaster, maybe in the department, maybe a fire has happened in a certain department, maybe something has happened in your department. Do you know how to activate the system so that the event is well coordinated? And this is what we are actually doing, even through training everyone so that they are able to respond accordingly and according to disaster plan and the policy guideline. Conducive an environment structurally to handle the disasters. At Kenyatta National Hospital, because the role of Kenyatta National Hospital is how prepared we are, I can attest that Kenyatta National Hospital is well structurally prepared in that it has secluded or isolated 2 wards, which can carry a capacity of 60 patients at any given disaster incident, and ensure that those wards are well equipped. There is a team leader. There is a team which is kept up to date on in terms of knowledge, skills, and practice, and also attitude change or organizational attitude change. They are nurtured in such a way to know that if a disaster is happening, they have no social life, they have to respond to the disaster, regardless whether you're on leave, regardless whether you are off. And I can attest that we have the best of the disaster management team in Kenyatta National Hospital, which is led through the CEO's department or section to the Senior Director Clinical Services, where she is very passionate about that structure, because our aim is to ensure that Kenyatta is prepared for management of any incidences or any disasters that come to Kenyatta National Hospital. On top of that, Kenyatta National Hospital has got an emergency operating procedure in place. And for that matter, we also have a section which is under custody of the Senior Director Clinical Services. And we have a disaster command center, which is actually manned by a disaster trained personnel. So that one we can say, actually, Kenyatta, in terms of risk and preparedness for disasters, we are well prepared. Protecting and empowering the staff on emergency and their response, it is very key. All the skills that are required to manage the disaster or any incident, these staffs are well trained, and we have also a training section in our human resource department which coordinates that, and we also have a coordination on disaster training courses through the disaster committee area, where we isolate which trainings needs to be given to our staff so that they can adequately respond to the disasters. Then after all this, do we test this? Yes, we tested our preparedness and updates on responding the plan through doing drills, and we have got 2 recorded, and they are in our PC or performance contract, where we have to do at least 1 mass casualty incident every year and a fire drill, and it is done quite okay. And that one is evidence with the reports and the partners who participate in it. And actually, I can say it is countrywide, because it is involving the external stakeholders, so that as a state hospital, we are able to be well coordinated in the event of a disaster. Then partners and stakeholders, I can overly emphasize, because we have got even a written MO which is in progress, and this one is there to make sure that we are well coordinated in terms of disaster management. Then, when we analyze the hospital emergency preparedness, it has come now, and this is not a premise, it's a research that has been done, that large-scale emergencies, and this one has been based from the history or the disaster that's happened, a bomb-blasted disaster that Kenyatta National Hospital had 1686 casualties who came to Kenyatta Hospital. So out of that, we were able to do a lot of improvement in terms of disaster preparedness. And the premise has come that large-scale emergencies and disasters display some element of organizing medical emergency response as a prominent role in incidences. And that is where we are talking that Kenyatta National Hospital, currently it has established a team which calls itself Disaster Management Team for Kenyatta National Hospital, to respond for any disaster or emergency that is coming, and the patients are to be managed in our hospital. So they are there on a standby 24/7, 365 days. There is a lot for them, and they are actually ready for any response. Then these and the other well-published incidences have captured the attention of government authorities, regulators, and the public. Actually, if we read in the regulation of 2014 in the government and the Parliament Act of 2003, this is where the budgeting for disaster incidences came or originated from, and this one is due to the published or recorded or documented incidences that were were already in place, and there was a need for the authority or the government to put this one into very serious docket and put at least a budget for the disaster in the event of any. And instead of all that, it was putting in place that by the time the disaster happened, there is a need for preparedness. So most of it is used for training and ensuring that what might be required in the event of a disaster is in place. Then the other analysis that has come up very well is the healthcare has assumed a more prominent role as an integral component of any community emergency response. Community in the hospital setup is very key, because if we look at it, before we thought that we could have an internal disaster, we used to think of the premise or the what can I say this so that people understand what I'm seeing? What used to be assumed, or the assumption was the hospitals may not have a disaster, but we are looking at it that now, as much as the hospital may have a disaster, majority of it will come from the community. So there is a need for the community to be empowered so that they are able also to respond and give us faster information, timely, so that the golden hour is achieved, and they ensure that the casualties that have been involved have a gist on what is expected of them. And what Kenyatta National Hospital is doing is doing disaster mitigation studies, so that we are able to tell the community exactly what is expected of them in the event of a disaster. When a disaster is happening, they need to know the link. Who do they communicate to? And so that those communication will come all the way to Kenyatta National Hospital or to any agency that can help to save their life. Then increased funding and the budgetary allocation by the government and the plethora of the new preparedness guideline for emerging global disasters. And when we are talking about emerging global disasters, we are not only talking about the collapsed building, we are not talking about maybe the terrorism, the one we are used to. We are not talking about bomb blasts. We are not talking about RTA. We are talking about the emerging global disasters like CBRN. And this one, it is important for all of us to know that it is a responsibility at individual level to be sure that safety is very key, because security starts from an individual perspective. Methods to objectively measure the results of these initiatives are only now being developed. And I can attest that Kenya, being an disastrous country, or being the country where we are not prone, especially to natural disasters, it is not something that has been giving us a lot of headache. But from the look of things, the way we are coming from the analog to digital side, there was important to develop a JESIP. JESIP is Joint Emergency Services, interoperability principles. And this one is to ensure it is, let me say, this is an initiative that we are borrowing a leaf from British company and the Kenyan government, so that we are able to link up internationally. Because if you look at the scope of Kenyatta National Hospital, you hear it is the largest hospital, which covers East Africa, Africa, and Sub-Saharan. And it is true, because from our record, we have managed patients who are outside our continent. When we look at clandestine lab, there are these things that we have been assuming it is normal, but it is not normal. If you look at, I'm not talking about the laboratory where we are doing our investigations, we are doing biological investigation like blood workers and all this. I'm talking about the things which are being manufactured in the labs, and we may not have thought that they could cause disasters, called like biological kind of disasters in CBRN. Some of these things can be done in clandestine labs, and Kenyatta National Hospital at least has trained about 6 people to deal with the clandestine lab, and we are ahead of the game. It is clear that the hospital readiness remains uneven across Kenya and globally. There is no any one hospital or any one organization or any institution that can say, wow, if it is happening, we are self-sufficient. That is why we have to maybe look for other key players who can help us deal with the emergencies or disasters. Without significant disaster experience, many hospitals remain unprepared for either disaster. Either it could be natural, it could be man-made. So what are we talking about? This is why Kenyatta National Hospital has extended a scope to ensure that we are enlightening or empowering other people apart from Kenyatta National Hospital on what is required for any hospital to be prepared. What do you require to have at hand in the event of any eventuality before you think of referring the patients to Kenyatta Hospital, which is the referral hospital in the government. So we are going further and telling ourselves, can we be prepared? Before we go to question and answers, I would want to say, after doing all this research on what is happening, it is important to know that there are recommendations on this presentation. Number one, there is a need for good planning to build and strengthen health resilience. If an hospital at whatever level is going to be there, it is important to know that it is there to be prepared for anything. What you don't have, where can you obtain it? What do you need to have so that you can have a good preparedness in terms of response to any disaster or you are called upon? The other recommendation we are coming up with is there is a need for strengthening health systems, meeting needs of the vulnerable population. Vulnerable population could be the pregnant mothers. There could be people living with disabilities. There could be young children. There could be women. How are we going to ensure that they are safe in the event of a disaster has happened? For example, there could be maybe a conflict or maybe disagreement on what is happening, and there is war in those sections. Those are the vulnerable populations which we need to be thinking, how do we make sure that they are safe? Promoting organizational competence, social connectedness, and the psychological health. When we come to most of the hospitals, we have never thought of all this, and now it is coming up very clearly that now we should not take things normally. If we take normally, they will take us abnormally. So we needed to do what we needed to have at this particular time, at this particular season, at this particular section, that we needed to be prepared for any eventuality. Hospital-wide, the thematic platform for all staff in risk identification and the reduction in all departments. That one I've said, and we have already overemphasized. If Kenyatta is able to do hazard vulnerability as one of the hospitals in the country, also other hospitals should do the same. We always cannot be self-sufficient. We learn from others, and it is important for all of us to be having the same aim of saving lives or making sure the human anatomy is safe at all aspects. When we look at it, a disaster has happened. If we are looking at in many dimensions, that if you are not affected, you are infected, or if you are infected, the others are affected. How do we come with this? We need to come up with a modality as hospital setups that we need to have a psychological area where we can relay anxiety of anyone who has been a victim of circumstance. Then community resilience is very key in encouraging actions that build preparedness. When we are talking about community being encouraged to build preparedness, if the community is not aware of their actions, can cause a large mortality or can cause an economical effect to the country and to themselves, we are not doing much. So it is the key for us as people who are aware of what is happening, especially hospitals who are receiving these patients from the community. It has to go down to the community and tell them what is expected of them so that they can also be our key players. When a disaster is happening or is about to happen, they can alert the hospital. This is what is happening. So you need to do what? We need to prepare for the patients as early as possible because this is what is on the ground. Then it promotes strong day-to-day systems. I think this one has been done very well through our referral system, but now not everyone knows this. That is why we want to build the referral system to other hospitals who are our link hospitals, so that they are able to know at what level are they able to manage their casualties, at what level do they need to manage, and what condition do they need to manage to refer to the higher hospital, so that we achieve for the patients, instead of the patients who could have been managed in the lower hospital coming to Kenyatta for the space which could have been a benefit to the patient who required that space or that specialty. Then we need also to address the underlying social determinants of health. These are so many, it is so wide, and actually, as Kenyatta National Hospital, what we are doing, we have mobile clinics who are going down to the community to ensure that the things that needs to be done, maybe vaccination, maybe healthy talks, is being done on the lower level, and the people who are there, they are being translated on what is expected of them, so that Kenyatta National Hospital level 6 can take its law at its capacity and capability. Then the other recommendation is investing in capacity building at all levels, like from the community to the national levels. From the ground, that is why we have the primary, we have secondary, until we come to the tertiary level. But it has to be very key that we don't ignore anybody for this game, because everyone is a partaker of the cake. And for this matter, is not the sweet cake which we know, is the cake which is requiring us to have a lot of critical thinking so that we can achieve maintaining the resilience of the affected victims. Interoperability with a wide range of partners or stakeholders, particularly those who work routinely addressing health, wellness, or social well-being. We cannot overlook the people who are actually being involved in any incident that has been observed or has taken place. And for this particular time, we are talking about the ambulance people. We are talking from at the lower levels, which are on daily basis dealing with the community, and these communities, they are dealing with the conditions that can be prevented. So we cannot overlook them. So we need to work as a team so that we are able to give them the direction on what is expected and on what modalities they need to use, so that we are able to maybe prevent most of the incidences that are preventable. Then emphasis on research, we cannot avoid that. And where we are seated, where we are giving this webinar, we are sitting on the research center, who are very key to us as an hospital to give us the current scientific proven ideas on what is expected to be done at the right time by the right people at the right place, so that good decisions and actions are taken care of. Now, from that presentation, I would want to pause there and welcome any questions or clarifications, and I will hand it back to our able moderator. Thank you.
Thank you, Pauline. That was well presented. You've definitely made all of us aware of what Kenyatta is doing in regards to disaster management. We only have a few minutes for questions. And I see we have one from Chris Mwangi. Would lack of deposit be a reason for denial of emergency services? Well,
I think it is good to let Kenyans know that, and that is why we started with the policy and the regulations. In the event of a disaster, the Kenyan government has put something in consideration of that, because as we know that disaster has no appointment, nobody has got this budget. However, if a disaster has happened and you are landed to Kenyatta National Hospital, you are not denied the chance of being taken care of, because these are emergency situations and the other issues are dealt with as we proceed, but you are safe. And the other question I'm seeing is, what is CBRN? CBRN is an acronym of C for chemical, B for biological, R for radiological, N for nuclear, and the E for explosives. I'm sure that one we are going to do with it. And I think by the end of this section, I will give you my email so that you are able to email any other question you have, so that we are able to clarify and make sure that you are in the safe hands.
We have another question from Monica. Which are the international stakeholders and which disaster have you experienced of late?
Thank you, Monica, for that question. As we started with our introduction, we usually actually said Kenya is not a disaster-prone country. However, we cannot say that we have not interacted with them. What Kenyatta has done is taking us out for more exposure in terms of disasters or various disasters. I can say we have interacted with European nation. We have interacted, and this one was in terms of disasters dealing with mass weapons of mass destruction, where we are able to see what happens. And this one is coming in terms of maybe things to do with the chemicals, biological, radiological, that is the CBRN disasters that we may become across with. And to be also very precise there, I want to say that these international stakeholders, there are actually 193 stakeholders who are members, and Kenya is among them, on an organization called Organization of Prohibition of Chemical Weapon Disasters, which Kenya and Kenyatta, for this matter, we are members of that stakeholder organization, which to us is a very good thing. And we are put in an area that Kenyans are safe when they are able to come to Kenyatta National Hospital and they are taken care of when they have been maybe exposed to a disaster dealing with CBRN or maybe weapons of mass destruction. Thank you.
You have an
we have the next question from one of our attendees. Is asking, do hospitals across the country have a coordinating body for disaster management? Example, suppose there's a disaster in Nairobi, how would hospitals or ambulances know where to send the cases?
This is a very good question. I don't know why they should be anonymous. We should actually identify yourself. It's a very good question, and I'm happy to respond to this question. As Kenyatta National Hospital, yes, we have got a hospital incident command system, and its work is to do the coordination part in the event of disaster management. But now it is not, you are first about in Nairobi. Yes, there is that coordination from the disaster management unit and the National Disaster Operating Center, which is an internal security arm of government, which in the event, actually we work very closely with them, so that when the disaster happens, before even Kenyatta is aware, that is the harm that alerts the KNH that we need to prepare. Then as we activate our X system, which has happened before, like we can say there is this disaster which happened it was not a really harm, but there is a Dusit one, which we can remember. Before Kenyatta knew that there is a Dusit kind of a disaster at the Westgate, the harm of the government had already been alerted that they activated KNH, and the KNH also activated the our IT system so that we were able to respond to them. However, they may not have come to the hospital directly at the first instance, but we had already been alerted that we were aware and ready to respond for that disaster in the event that it landed to Kenyatta National Hospital. Thank you so much.
There's another question. How about linkages with other agencies, ambulances, police, city traffic, etc.?
Thank you so much. You know, this is very good, and that is why we are doing this presentation, so that we can take a lead from Kenyatta National Hospital. It has to do our SWOT analysis in our capacity wherever we are, so that we are able to prepare like Kenyatta is preparing. Kenyatta has already done it, and we have known that we cannot be self-sufficient. So what we have done is ensuring that we have a memorandum of understanding with the ambulances, with the police, with the maybe other hospitals, because our hospital cannot hold everyone who comes to Kenyatta National Hospital in the event of a disaster. And there, I can assure you that we needed to know what next. All of us who are to whichever capacity, let's have a contingency plan on how to handle a disaster. If it is coming, for example, and forgive me, Kiambu Hospital, if it is that Kiambu Hospital has gotten a disaster around there, they should have their contingency plan, and they should also have a policy on how they are supposed to react to their disasters and respond. In the event they need Kenyatta National Hospital to come in, they know how to refer using our referral system and make sure that patient who is coming here, we are coming to save the patient, not to deposit the patient to Kenyatta who has already lost the first golden hour of life. Thank you so much.
After how long, there's a question from Geoffrey. After how long does the policy review take place, and what parameters are used to justify the quality of emergency preparedness and emergency of Kenyatta?
Yeah, thank you so much, Geoffrey. Yes, Kenyatta National Hospital has got a disaster plan and policy, and the one which is currently being used, it was already reviewed in July, the year 2020, and it was virtual because of, we know what was happening. There was COVID, but our plan needed to be ATIPA, so it was reviewed, and we reviewed after every 3 years. Now, how do we test this one and the parameters? We test this one through doing what we are doing. Number one, it is a guideline on what is expected for all the workers or all the staff in the hospital to follow. It is a guideline document. So how we are testing it and its parameters is through maybe, I've said in the presentation that we do at least an annual drill. And this drill is one way to test how prepared are we in the event a disaster happens, and how do we respond? How capable? What is our capability? What is our capacity in the event of a disaster? How able are we able to respond to the disaster? How able is able? So those are the innovations we are doing, and we are also interacting with other government stakeholders and other hospitals. To name a few, Kenya Red Cross, Nairobi Hospital, the Kenya Police, the NDMU and DOC, they are our stakeholders, to name a few. And I think it is a good thing, even the other hospitals or other entities that are dealing with human life, to do what Kenyatta is doing, because we need others. It is a multi-agency kind of an incident or event.
One last question from Dixon. Apart from emergency services, are there plans to cushion the affected against any other extra medical costs, maybe through NHIF or waiver?
Thank you so much. I said money is never enough and nobody is ever prepared, but it is the right time to inform our Kenyans, now that we have got that hand that can give us easy life, NHIF. If you are able to join NHIF, actually me, I'm one of those people who encourage every person, including my, what do I say, my immediate relatives, they should be members of NHIF. I'm an employee of KNH, but in the event, God forbid, my mom needs less like 10,000 now, I cannot be able to afford. But because he has been registered or I've registered her in NHIF, it is very good for me and it is easy for her so that she is able to assess the best health service that can be offered to my parents using the NHIF. Most of the time, for example, I don't even understand. My mom has been sick and has attended an hospital admitted. I'm only being called to go at the discharger and take her home because every budget has been taken care. In the event of a disaster, Kenyatta National Hospital, we have got a contingency plan of budgeting for our casualties. But I've always said money is never enough. So it is good for us to have a contingency plan. We don't know, a disaster may happen. And there are those incidents that happen and it is not declared as a disaster. So KNH doesn't stand for that. We only stand in when it is a declared disaster event. And that is when we activate our budget for that docket so that that patient can be maybe waived through that docket.
Thank you very much for all the questions. Thank you, Pauline, for a job well done. I think we've all learned a lot. In the interest of time, I think we'll be closing there. Maybe just in summary of what she's done. She's told us about disaster preparedness and response in Kenyatta, which we've seen considers both external disasters and internal disasters. And the guiding principles are 1, the disaster cycle, and 2, making sure we have collaboration with the relevant parties. Thank you, everyone. I'll see you in the next CME.
As we close, we agreed that we are going to give email in case of any clarity. And please don't log out before you get it. We are typing for you so that you are able to reach me for any clarification or any question you need to be at par with the Kenyatta National Hospital staffs, especially disaster management. And it is already there. It is, yes, www. It's paulinejoe@gmail.com. I will be glad to help each of us who is stuck in disaster preparedness. I can help you come up with the mitigation measures and we be prepared for any disaster and the response. In the interest of maybe requested through my institution, through the CEO's office, I think Kenyatta National Hospital is ready to ensure that any hospital is prepared to respond to disaster through best preparedness. Thank you so much for listening. Thank you for learning a lot from us.
Have a good afternoon.